Thank you, Mr. Carr and Chair and Board. Marnie Kyle, Director of Health and Human Services. And I have updated this slide deck slightly since our meeting earlier today, just so that you have the latest information as you consider enforcement of the state mask mandate. So we can go to the next slide. So as you know, Governor Brown issued an indoor mask mandate on August 13th that requires a mask be worn in all public indoor spaces, whether folks are vaccinated or not. The reasoning behind this was really hospitals are at the breaking point, and I'll show you some data in a couple of slides. We know that vaccinated people are much less likely to get sick, but they can still be infected with COVID-19 and they can still transmit the virus, although it's at a lower level. But we also know that properly worn masks can greatly reduce virus spread. So our two most effective tools in preventing COVID-19 hospitalization, ICU, and death are, number one, get vaccinated. So we're really continuing to encourage all of our residents, if you haven't been vaccinated, please consider getting vaccinated. Talk to your healthcare provider, talk to your family members and friends who have been vaccinated, and consider getting vaccinated. If you have been vaccinated, please talk to your friends and family who have not, and share your story about why you were vaccinated, how safe it is, how effective it is, and that it can really save lives. Our second tool is properly worn masks, because that can really reduce the spread. With this mask mandate, Oregon OSHA can fine, but rarely does, because they're really overloaded with complaints. So right now, Washington County local public health has very little enforcement power. So next slide. So today, Governor Brown issued an outdoor mask mandate. The masks are required in public outdoor spaces, again, whether you're vaccinated or not. It applies to most outdoor public spaces, especially if you're unable to maintain physical distancing. They are also strongly recommending that we wear masks for private outdoor events when there's people from different households that are gathering. The one thing that this doesn't apply to is those fleeting encounters. So if you're walking in the park and you just walk by somebody, you're walking your dog, or you're out skating or outdoors in parks and trails, you don't have to wear a mask, because those are very fleeting, quick moments where it's unlikely that you would transmit COVID. This outdoor mask mandate is effective as of this Friday, August 27th. Next slide. So why mask mandates? And you've heard this lots of times from me, but we already mentioned that hospitals just cannot keep up with demand for staff or for beds. And this is one of the updates. The number got bigger from this afternoon. So there's currently 1,000 people hospitalized in Oregon and 283 that are in intensive care across our state. In Washington County, there's 85 people that are currently in the hospital and 21 who are in intensive care. This virus, the Delta variant, is making more people sick than we've ever seen before. Washington County reported the highest case count ever since the beginning of this pandemic on August 23rd, with 400 cases in a 3-day period. So that's well over 100 cases per day. So we're very concerned about this. It's impacting younger people. We're seeing younger people in the hospital more, and we're seeing increases, significant increases in the pediatric population. Next slide. So this is just a graphic really showing what I just talked about. You can see the blue line on top is the number of patients in hospitals in Washington County. And you can see that beginning in mid-July, that steep increase in the number of cases. And the bottom line, the orange graph is showing ICU cases, and you can see virtually at the same time the increase in patients admitted into the ICU. And as a reminder, the ICU is what we all depend on for severe emergencies, like when people have a heart attack, when they're in a car accident, strokes. So every one of these beds that's taken up by a COVID patient is a bed that is not available for other extreme emergencies. Next slide. So the indoor mask mandate, here's what the requirements say from the governor's office. So persons responsible, so in other words, the business owner or manager, the person responsible in the business, must make reasonable efforts to ensure customers and visitors comply. And that means at a minimum, posting signs at every entrance. And if businesses are doing this, then they're meeting that minimum standard of ensuring reasonable efforts to ensure customers and visitors comply. The other thing is we really encourage, in the governor's office, and the order encourages businesses to make masks available. And we're doing what we can in our community to support businesses as in providing PPE as necessary. And then there's other announcements that they can make on their overhead intercom systems and radios to encourage mask wearing. So some of the challenges with these requirements is we get asked every day, many times a day, what is a reasonable effort? Signs are the only thing that are mandated. So some businesses forget to remind customers, but everything that they can do is helpful. We also get a lot of pushback from businesses that they don't want to enforce this mask mandate. They're there to provide good customer service, and they need help enforcing the mandate. So next slide. So Washington County efforts, the public can make a complaint or address concerns about enforcement of the mask mandate to our email address, which is eoc-covid-enforcement@co.washington.or.us, or they can call and complain at 503-846-8390. And so right now, this is a complaint-driven system, and we intend that it would be a complaint-driven system. We're not out on the road looking for non-compliance. We're not driving around policing masks. It's complaint-driven like all of our code enforcement. But the process really starts before we ever get a complaint, and making sure that all businesses understand what the requirement is. We provide information in a lot of different formats and make sure that we're reaching out to our businesses, answering questions, providing tools, providing question and answer, phone calls, whatever we need to do to support them and help them by starting with outreach and education. So as far as enforcement, we're currently using a three-strike process that I'll go over in just a minute. And we give businesses lots of chances, and almost all of them comply. So next slide. So here's the three-strike process that we currently use. The first complaint is what we're calling in this presentation strike one. And what happens is we get a complaint, could be from an employee, it could be from a visitor to the business, sharing that the business is not enforcing the mask mandate. So the first thing we do is we call and we email and talk with the business. We ask to make sure, do they understand what the guidance is? Do they have the tools that they need? What can we do to support them? If we never get another complaint or call, then that's the end of it. If we get additional complaints, then we send a follow-up email, and we send what I'm calling a more stern letter that says you must comply, and here is the steps that happen if you don't comply. And then strike three is when we continue to receive complaints. At that point, we visit the business And if we find that the business is out of compliance, then we refer that business to Oregon OSHA. And what I would say is that based on history, in 2020, when we first started enforcing some of the governor's orders, whether it was masking or capacity limits or indoor or outdoor activity, we, out of all of the businesses, we only had a handful, less than 10 businesses that willfully would not cooperate and comply with the orders. And so we're really talking about just a few businesses. Most businesses are complying. And so some of this is really about fairness and supporting those businesses that are doing the right thing and are complying, so that everybody is held to that same standard. So we'll go to the next slide. So what public health is recommending is that we be given the ability to enforce the mask mandate. And that includes adopting a fourth strike, which includes citations and fines for repeated offenders. The fine, according to the Oregon guidance, can be up to $500 daily for a business that's violating the order. And just as a reminder, by the time the business reaches this fourth strike, it really is willfully and repeatedly violating the orders. So the next slide is just a graphic of what I just described. So the first complaint, call and email the business, work with the business, provide tools, answer questions. Second complaint on the same business, email, send a letter, the more stern letter. Third is a visit. And then fourth, we're proposing for your consideration the issuance of citations and a daily fine. And then Brad is going to go over implementation of the citation and fine on the next slide. You're on mute, Brad.
Good evening, Commissioners. Brad Anderson, County Council Office. So Health and Human Services and County Administrative Office asked our office, how can we do citations? And so we did a fair amount of research into what the process could look like, and the easiest way to put it into our current package of code enforcement. So what you have before you today is a resolution and order where you are sitting as the local public health authority for Washington County, which clearly you are, and that means that it applies countywide, not just in unincorporated Washington County. Under state law, you have the authority to enforce public health measures, and you have the ability by rule to do so. So what you have before you is based on a bunch of state laws, a proposed rule that basically states that our current enforcement process, which is found in Washington County Code Chapter 1.12, that's how we enforce codes, is the process that we would use to enforce state and local public health measures. So that's what you have before you today. There was some discussion this morning or this afternoon about specifically the mask requirements from Oregon Health Authority and this penalty that's up to $500 per day per violation. We would comply with that, and using our ordinance, we would issue Class C infractions, which have a fine over $500, but we would only do $500 because that's all we can do under the current state administrative rule. So that's what we're proposing before you today. Are there any questions for Marnie or me?
Commissioners, any questions of Ms. Kyle or Mr. Anderson? Go ahead, Commissioner Rogers.
First of all, thanks, Brad, for answering a lot of my questions this morning or this afternoon. Uh, Commissioner Willie made a point, and it's a good one regarding corporations, and you didn't elaborate on that. And then what's a business? If I run a nonprofit, is that a business? Or if I run a church, is that a non-business? Or is that a business? Do we have definition under our code?
So Commissioner Rogers, we don't have definitions under our code, but we do know under the mask administrative rule that businesses are basically anybody who runs an operation. That could be a nonprofit, that could be a group like you have of CPAs, et cetera. It's very broad.
I can read the definition right from the State Public Health Division Chapter 333, mask requirements for indoor spaces. Business means an individual, organization, or entity engaged in commercial, industrial, or professional activities.
Would that include a church who decided that they didn't want to follow the mandate? I'm trying to listen to what it said specifically.
So I did specifically ask the governor's office about churches, and they said there is no exceptions for churches. So that means it does indeed apply to churches.
And Brad, the only reason I'm asking is because we're going to hear, various things, but is the linkage between our code and state law sufficient that the interpretation will be the same, or is there any cracks in that nexus so that somebody could say, no, it's different?
I don't think so, because
Okay.
basically we are enforcing the state law via our enforcement ordinance. So I don't see a problem there at all.
Okay. Thank you. I have other comments, but I'll do that after the motion.
Okay. Do we have any other questions before we have a motion? Go ahead, Commissioner Willie.
Yeah, I was just asking if there's any other counties or cities that have this type of mandate where there's a fine capability at the end of the day.
So Commissioner Willie, thank you for that question. I know that Multnomah County is, we have shared this work with them, and they are in conversations to do something similar. They're the only other county that I know of right now that is considering this step in the enforcement. I will not be surprised if others don't follow suit. Definitely other counties are interested.
Okay, unless there are any other questions from commissioners, I would ask if there is a motion. Excuse me, I want to make sure I use the phraseology out of the current packet. Do we have a motion to support the Oregon Health Authority's face covering mandate by adopting a rule authorizing the issuance of civil citations to enforce public health laws? We have a motion from Commissioner Treese. We have a second from Commissioner Willie. Okay, and I'll now open the floor up to commissioner comments. Does anyone wish to comment?
Nobody's jumping in, so I will. First of all, I would acknowledge that we've had a few hundred communications saying that they're not supporting. So I acknowledge that. Secondly, I would acknowledge that their principles are correct. People ought to be free not to wear masks, and I understand that. But the fact of the matter is that people are living in very close proximity, and your right to be free doesn't infringe upon my right to not be infected, my kids' rights, my grandkids' rights. So I'm supporting this tonight, and it's not because I'm anti-freedom. I believe very much in it. For those of you who choose to make certain decisions, I respect that. But it's a shame that our hospitals are being filled up by your decisions, and our health system is being taxed by your decisions, and my insurance costs are going up because of your decisions. If this were, a couple hundred years ago, and we all lived several miles apart from one another, that would be great. If you get sick, you don't affect my insurance rates. If I even had it in those days, you wouldn't infect my particular family or my situation. So my vote yes has nothing to do with the legitimacy of your comments. I respect them, and I happen to agree with them. It's just that it's not practical in a society where we're shoulder to shoulder. We share lots of open spaces and closed spaces together, and we also share costs and burdens of costs for hospital systems and insurance costs. So I think it's the right thing to do, and I think we're following state law. And I think that there's, thank you, Brad, for talking about this afternoon. There is lots of what I call safe harbor language for you businesses. It's easy not to get cited. I mean, it's very easy. Make reasonable attempts. That's all being asked. So I think we've done a reasonable job, and it's sad to me that we've come down to this point. I wish we weren't here because it's unnecessary. It's really unnecessary. It would be so easy not to have this situation. So I just want to make that comment because it's fair to those who've written in and said, I don't like it. Why are you doing it? I don't want to do it either. And I agree with you. But there's always a big but. We've got other responsibilities. So don't want to hog the airtime. That's just my comments for tonight.
Thank you, Commissioner Rogers. Commissioner Treese.
Thank you, Commissioner Rogers, for your comments. I think the other piece that we need to talk about is that we are in a pandemic. This is a unique situation. We're dealing with unique issues. We're dealing with a population base that is choosing not to get vaccinated, and it puts many of us, particularly our youth, at risk. And as a commission, I feel that it's our responsibility to make sure we're making every effort to protect all of our residents in Washington County. And while at the same time supporting our businesses and allowing them to function, I'd like to really underscore what Ms. Story said about the fact that this is not directed at the majority, at the very high majority of businesses and people who do comply. This is going to be appropriate in a very limited situation to a very small group of businesses that are taking a stand that's inappropriate for the rest of the health of our county. So I support what you said, Commissioner Rogers. I just wanted to elaborate a little further on what those issues are and what we will see as a result of this enforcement issue.
Thank you, Commissioner Treese. Go ahead, Commissioner Willie.
Well, I just want to re-emphasize what I said earlier this afternoon when we had this in work session. For me, this is supporting those businesses that are in compliance. And we want to make sure that the playing field is level. And so those businesses who are not in compliance, we need to have some teeth in the ordinance that the governor has put out there so that everyone is playing by the same book. So that's why I support this.
Thank you, Commissioner Willie. Commissioner Fye, would you like to add anything? No?
No, I don't have any comments. I just want to say everyone be safe. A hurricane is coming. Protect your loved ones and protect your neighbors, and wear your mask and get vaccinated, and help where you can.
Thank you, Commissioner Fye. I'll close with, as Commissioner Rogers mentioned, we've gotten many emails on our efforts to reduce the spread of this Delta variant of this killer virus known as COVID-19. In addition to our weekly constituent report, which had 79 different emails on different topics, but there were many emails there that commented about mask enforcement. We've also received yesterday, our staff compiled over 430 emails for us. And today, an additional 83 have come in. So we have well over 525 emails on this topic. And as Commissioner Rogers noted, there were several emails in there that talked about individual decisions. Over the lunch break, and I think it's one reason why my brain is kind of tired, over our dinner break, I was only able to read 200 pages of that 506-page report from yesterday. So I got through over 180 of the 430 emails in that report. And I categorized them from the standpoint, many were about individual decision-making and freedoms. Others who were against the combination of, it was a common email, masking, closures, and vaccine passports, where, you know, they've gone way beyond what we're talking about here. About 31 of the emails I was able to read just didn't think there was any scientific evidence to support masks in reducing spread. And then there was all kinds of colorful language used in some of the emails as well that I won't contribute to here. For me, this is all about fighting this terrible killer virus. And I want to make sure that everyone is clear. There are no law enforcement personnel that are going to be used for this mask enforcement. It's going to be our Health and Human Services Code Enforcement team that does this work, just as they did with the enforcement work that we did prior during the 2020 and early 2021 efforts around capacity restrictions and masking. But for me, the real thrust of this, two things: protecting our children and those who are unable due to health conditions to get vaccinated. Those are the folks, the people in our community who are relying upon us, each of us, to do the right thing, to help protect them. We are making this decision as the Public Health Board for all of Washington County. It is our responsibility to take on issues and needs like this. And I thank my colleagues for taking action, providing leadership on that. I wish we could do more to affect the strain on our hospitals, but we've learned from our regional public health experts that our efforts to do that as one county would not make a dent in the problem. And here's the other aspect of this: preserving our economic recovery. As Commissioner Willie talked about, keeping businesses open, having that level playing field so that all those businesses that are doing good things to protect their employees and their patrons are on the same level as those who right now are shirking their duties and hurting our community members, as Commissioner Rogers talked about. So thank you to each and every one of you for the extended discussion that we had earlier this afternoon about the scary state of this virus and the fact that we have almost double the hospitalizations that either are occurring right now or projected to occur over the next 2 weeks before we see the peak of this Delta variant here in Oregon. So with that, we have a motion and a second. All of us have had the opportunity to make comment, but are there any last comments before we take a vote? No? All right, all those commissioners who are in favor of adopting the motion to take this action, please vote by raising your hand or saying aye. Thank you, commissioners. Any opposed? The motion carries unanimously 5-0. Thank you very, very much for contributing to the health and wellness of all here in our community. I think we really are leading the way for other counties here in Oregon.